CBS 7 News presents Closer Look.
There is new hope in the fight against Alzheimer's. A new study suggests 2 years of exercising, eating healthier food, and doing a little brain training boosted people's memory function. It's the first proof that some of the things people have been trying to prevent Alzheimer's may actually work. The study done in Finland doesn't point to any one thing people can do to prevent memory loss. Instead, it's a cocktail. Well, joining us now live via Skype is Carrick Brain Center Chief of Neurology, Dr. Andre Ferdue. Doctor, thanks so much for joining us.
Thank you for having me. I appreciate it.
Now, Doctor, I have a couple quick background questions for you. First of all, how many people are affected by Alzheimer's, and what are some of the early signs of the disease?
Well, Alzheimer's is now becoming, due to the baby boomer generation, is becoming a more common neurological condition. As far as the number of people that are diagnosed per year, those numbers usually range in somewhere in the neighborhood of 200,000 to 300,000 people can be easily diagnosed. It's one of those conditions that when we look long term, because we're all living longer, the number of patients that are going to ultimately be who may be affected by this could very easily reach into the high hundreds of thousands to a million patients per year by the year 2050. So it's going to become a more prevalent problem as we all grow older. The things that we need to keep in mind regarding Alzheimer's dementia, and dementia is on a long continuum, okay? So you have what is called mild cognitive impairment, where some people may forget where their car keys are, or they may forget a phone number or a name, but usually that information with being re-cued, that information can come back to their remembrance. Then you have patients that actually have kind of the mild to moderate dementia, where they're able to function with their everyday activities, but they have more profound issues with balancing their checkbook or creating a recipe or doing some of the things that they've done over the majority of their life. And then you have people who have the advanced dementia, where Alzheimer's dementia falls into that group, where patients are really unable to take care of themselves, and they can even get to a point where they will forget to feed themselves, forget to bathe, and then they can develop a lot of opportunistic infections from that can ultimately lead to their death.
Now, is the secret to preventing memory loss really as easy as eating right and exercising and keeping your mind active?
Well, it's not quite that easy, but those are very important foundational building blocks. For individuals who are taxing their brain regularly at earlier ages, you have a little bit more of a cushion to prevent you from developing dementia later on in life. So, people who do a lot of exercising, mental exercise with reading and crossword puzzles and reading books and really engaging their brain, I like to tell my patients, think of your brain like a muscle. Not a muscle, but think of it like a muscle. The more you use it, the greater use you will ultimately get out of it. Eating the right foods is important because, that's the fuel. We talk here at Carrick Brain Centers about activating the brain and then the fuel source that's needed for optimal activation. If you're eating the right foods, fresh fruits and vegetables, lean meat, staying away from salt, grains, things of that sort, then you're not only your brain, but your body will process that better, and it will function at a higher efficiency level. And it's always important to just stay in contact with your primary care physician. Patients need to be followed on a regular basis from the standpoint of their overall physical health, because physical conditions like high blood pressure, diabetes, hypercholesterolemia, things of that sort can ultimately, if they're not well controlled, can lead to patients developing dementia at earlier ages.
Now, when is the time to start, start prevention in terms of eating healthy or exercising? When do we need to start?
You know what? The sooner you start, the better. If you have someone who is in their 60s or 70s and, they're feeling that, okay, well, I'm having a harder time with my memory, it's good to start at that age. If you have people who are in their 20s, 30s, and 40s, if you're living a healthier lifestyle, abstaining from things such as tobacco and alcohol and other things that can have an adverse effect on not only your body but your brain, you abstain from those things earlier in life, the chances are better for you that you're going to have better overall physical and mental health later. So you can never start too early, but you know what? You can never start too late.
Great. Dr. Ferdue, thank you so much for joining us today.
It was my pleasure. Have a blessed day.
You too.